Hello, this is Dr. Sudarshan Ray, psychiatrist, bringing you the latest in a series of psychoeducative videos which are aimed at raising awareness about mental health, about the common mental health problems, to consider the mental health problems as just another problem, just like the physical health problems, and treat accordingly. Okay, so today's topic, this is the first part of the topic on suicide prevention, and this basically deals with the intervention, the primary intervention the mental health professionals or even the caregivers, that is the relatives or the friends of the patient, can actually put forward so as to get the patient out of the rut for the time being, and then the patient can take care of herself or himself thereafter, and no more second attempts. Now, suicide or any self-harming behavior, SHB, is not necessarily a psychiatric disorder. Yes, it's not necessarily a psychiatric disorder. It is basically a coping mechanism which the patient thinks. I mean, in order to cope with pain. That pain may be physical pain. That pain may be mental pain, any sort of agony, and the patient actually feels very depressed. The patient expresses feelings of hopelessness, helplessness. Okay, and then patient also shows fits of anger. Then he or she talks about harming others, extroversion of the aggressive energy. Okay, and thoughts of revenge. And you see, there are chemical imbalances in the brain which are responsible for this occurring. It may be due to addiction, and the patient early coming out of addiction, and chronic pain, as I said, physical and mental, any sort of loss, any sort of bereavement in the family. Sleep deprivation is another factor, of course, which actually aids and abates suicide. This alienation from from the friends and the family or the society or the office, otherwise the colleagues, and there's the guilt and shame. Okay, so the idea of the mental health professional is actually to establish a positive relationship with the patient. So we have to be a very good listener. And of course, listening and establishing a positive relationship is half the work done. You should not actually talk to the patient about about their feelings. You should not confront their ideas, their opinions, and you do not confront the patient to make him or her feel guilty. The first and foremost is that you should not be judgmental. Okay, you should not be judgmental. Judgmental is something. Being judgmental is something which actually it's half the battle lost if you are judgmental. Okay. Now, once you ask the patient, you ask the patient about the cause of the suicide. I mean, what happened? What are the circumstances which had led to this miserable situation occurring? And you have to ask that the intent of the suicide. I mean, you have to be very clear. I mean, what was the intent for which the patient attempted suicide? Okay, and then you ask how does she or he feels now that the attempt has failed for good. I mean, whether the patient feels guilty, or the patient feels ashamed that she or he made such an attempt, or is the patient thinking of more determined that this time she or he has failed, so next time we'll plan better and see that the second attempt does not fail. The second attempt at suicide, self-harming behavior does not fail. Now, you have to ask in details about this planning, and the more planned the patient is about a second attempt, I mean, especially the time frame, the more is the risk of the suicide attempt, which is bound to occur. Now, you ask, as I said, you ask for the reasons. What are the reasons which led to this, this situation which led to the suicide attempt? And obviously, when the patient answers you, you give the time to the patient to answer. Do not rush him or her through the answer. And once he or she answers, you should actually be very warm. You should be very sincere. You should be very genuine, and that I mean not as a professional. You should actually be genuine, warm, and sincere, and the patient should get that idea also. Otherwise, how can you establish a positive relationship with her or him? So, I mean, you empathize with the problems. You should not use cliches like suicide is a permanent solution to a temporary problem. I mean, these cliches are something which are resisted by the patient and makes him or her more determined to make another second attempt. And obviously, the attempt at establishing a positive liaison with the patient is as good as lost if you use such a mechanism. If you confront the patient, if you are judgmental, if you use cliches, okay, so you should not do it. I mean, you should say yes. What you are facing is something that is really very important, and I do understand that your problems are very important, and yes, they are overwhelming, which actually had led to you making this suicide attempt to end your own life. But then once again, you ask the patient. I mean, as I said, the patient treats himself or herself. That's what I do in my private practice also. That you ask the patient that, okay, you used this suicide, this self-harming behavior as a coping mechanism. I mean, getting rid or putting an end to the physical or the mental pain and agony. So, what do you think? I mean, what else can you do to lead a better life apart from this, making these suicide attempts? You ask the patient, and when the patient himself or herself will come up with alternatives, and then you make the patient actually get into a verbal agreement with you, make him or her promise to you, of course, gently. Cajoling him or her, that before, if at any time in the future the patient thinks of attempting another suicide, self-harming behavior, prior to making the attempt, while planning, he or she should actually give you a call before proceeding. Because, and obviously, if you have established a positive liaison, the patient will actually do so. So, I mean, this is how this positive liaison will actually help you to talk the patient out of her attempts to make another suicide attempt. And as I said, that never underestimate the patient's problems. I mean, you should always, as I said, that sympathy is a factor which is detrimental. I always feel that sympathy is a sort of opium, and the patient craves for sympathy if you show too much of it, and that does not help matters at all. So, as I said, that empathizing, putting yourself in the patient's shoes and feeling the pain, be genuine, be warm, establish a positive liaison, ask the patient for alternatives other than suicide which will make his or her life better, and of course, before making a second attempt, if at all, then give a call to you or to any other mental health professional before proceeding. Okay, so this is the primary intervention which we can make. As I said, that there are chemical imbalances, there may be addiction, there may be loss, there may be alienation, anywhere. So multiple factors which lead to suicide attempts, and suicide is actually a coping mechanism which the patient thinks to end the agony or the pain, physical or mental. So let us approach it that way, and you do not necessarily have to be a trained mental health professional to do so. But I hope this psychoeducative video of mine will actually help you to primarily assess a patient or actually calm him or her down after failed suicide attempt, and that is of course going to help the society in a very very long way. And as I said that the liaison between the mental health professional and the society is what will actually help solve the problem. Thank you very much. If you like my videos, do visit my Facebook page, Dr. Sudarshan Sen Sharma, and do share this video and like and comment. So till the next video comes, this bye-bye from my end. Thank you.